Next question. Because about 15 to 20% of women carry the group B streptococcal organism in the vagina, it is now common to screen for this organism at about 36 weeks of gestation. When a pregnant woman is found to be GBS positive at this stage, which one of the following treatments is most appropriate? A. Oral penicillin therapy throughout the remaining antenatal period. B. A 2-week course of oral penicillin given antenatally. C. A 1-week course of oral penicillin given antenatally about 1 week before or term. D. Parenteral penicillin given 6-hourly in labor. E. Intramuscular penicillin given to the baby after its birth. Most of these women with GBS are asymptomatic, although some do have urinary tract infections and may develop a severe infection like meningitis, septicemia. Penicillin given parenterally to the mother when she is in labor will guarantee to protect the baby from severe infection. D is correct. Oral administration is not recommended. Although intramuscular penicillin given to the baby immediately after birth is effective, delaying the treatment after birth is unsatisfactory. Fetal distress is more common when the head is in the occipito-posterior position in labor. Which one of the following is the most likely reason for this? A. Prolonged labor. B. Intrauterine infection. C. Increased analgesia required. D. Obstructed labor. E. Incoordinate uterine action. Incoordinate uterine action almost always occurs resulting in an increased resting intrauterine pressure, thus, is likely to result in fetal distress. E is correct. Fetal distress is even more likely when a syntocinon infusion is used to augment labor and/or when an epidural anesthetic is used for pain relief. Although responses A, B, C and D may also result in fetal distress. CTG monitoring in labor is advisable in patients where the fetal head is in the occipito-posterior position, but is mandatory when a syntocinon infusion or an epidural anesthetic is being used. Next question. A 28-year-old woman who is 36 weeks pregnant has developed a deep venous thrombosis in the right calf. She has been hospitalized and heparinized. Which one of the following is the reason for choosing heparin rather than a coumarin derivative for the anticoagulant therapy? A. Any effect of heparin on the baby can be rapidly reversed by protamine sulfate. B. Rapid metabolism of heparin in the mother minimizes placental transfer to the fetus. C. Heparin crosses the placenta more slowly than do the coumarin derivatives. D. The fetus cannot metabolize the coumarin derivatives, so their effect on the fetus is increased. E. Reversal of the anticoagulant effect of heparin in the mother can be achieved more quickly than that of coumarin, should labor occur. Heparin is a large molecule and is not transferred across the placenta. Therefore it does not have an anticoagulant effect on the baby, even when it has an appropriate anticoagulant effect in the mother. In addition, the maternal anticoagulant effect of heparin can be rapidly reversed by protamine sulfate. E is correct. A. The anticoagulant effect of coumarin derivatives is also only reversed very slowly. Although coumarin derivatives such as warfarin can be given to the mother between 13 and 36 weeks of pregnancy, they should not be used in the first trimester because they are teratogenic. They take much longer to reverse than heparin. Next question. A 19-year-old prima gravida at 41 weeks of gestation has had irregular painful contractions for the last 9 hours. Pelvic examination shows the cervix is fully effaced but only 2 to 3 centimeters dilated. The fetal head is at the level of the ischial spines in a left occipito-posterior position. The membranes ruptured 1 hour ago. Which one of the following would be the most appropriate next step in management? A. Oxytocin infusion. B. Hydration drip of 5% dextrose. C. Cross-match blood. D. Cesarean section. E. Lumbar epidural block. When progress of labor is slow, consideration needs to be given to augmenting labor by rupturing the membranes when these are still intact, or commencing an oxytocic infusion. In this case, because the membranes have already ruptured spontaneously, the most appropriate next step in care would be to commence an oxytocic. A is correct. Subsequent progress will then define whether an epidural anesthetic is required and what the mode of delivery will be. Extra fluid is also required, which will be administered along with the syntocinon infusion. A lumbar epidural block is often necessary in patients with an occipito-posterior position, however this should not be used until more pain relief is required. Although a cesarean section may be necessary because of obstructed labor or fetal distress, it is not indicated at this stage. Taking blood and holding it in case cross-matching is ultimately required is common, but most patients do not have blood cross-matched prophylactically just because they might need to be delivered by cesarean section and need transfusion at that time. A 26-year-old woman has developed a fever and malaise at 10 weeks of gestation in her first pregnancy. 2 weeks previously she had come into contact with a child ultimately diagnosed to have had rubella. Which one of the following would be the most appropriate next step in management? A. Termination of the pregnancy. B. Serial blood samples for rubella antibody assessment. C. Gamma globulin intramuscularly to the mother. D. Amniocentesis at 16 weeks of gestation to confirm fetal rubella infection. E. Ultrasound examination of the fetus at 12 weeks of gestation. The rubella IgG antibody test, if positive, will show if the patient already has immunity. If on repeat after 2 to 3 weeks later, IgM will also become positive, then maternal rubella infection is the cause of the current symptoms. B is correct. Serial blood samples for rubella antibodies. A. Pregnancy termination would certainly be considered by some patients because of the well-known adverse fetal effects of rubella infection in early pregnancy. This would not be indicated on the grounds of fetal rubella infection unless this infection is proven to have occurred. C. Gamma globulin is most unlikely to be effective when given at this time in the infective process. D. Where maternal infection is proven by these tests, amniocentesis may be necessary to confirm fetal infection. E. Ultrasound may detect growth restriction in late pregnancy, but a fetal congenital abnormality is unlikely when infection occurs at 10 weeks of gestation, and would be unlikely to be detected on ultrasound examination at 12 weeks of gestation, although it may detect an anomaly at 18 to 20 weeks. A 35-year-old grand multiparous woman, with 7 children previously born by vaginal delivery, had a normal delivery of a live baby weighing 4,750 grams 1 hour ago after a 3-hour labor. She is now suddenly found to be profoundly shocked, pulse 140 beats per minute, BP 80 over 50 mm mercury, after an apparently normal and spontaneous third stage of labor. Total blood loss at the time of delivery of the placenta was 500 milliliters, and the vaginal blood loss since then has not been excessive. Which one of the following is the most likely diagnosis? A. Acute inversion of the uterus. B. Overwhelming infection. C. Uterinotony. D. Amniotic fluid embolism. E. Uterine rupture. The most likely diagnosis is uterine rupture, which is more common in grand multipara and is not necessarily associated with revealed external hemorrhage. E is correct. The shock becomes evident sometime after the rupture has occurred because of the extent of the concealed bleeding. Uterine inversion is very rare where the third stage proceeds spontaneously. It would be a possible cause of the shock if controlled contraction of the placenta has not been performed. There was no apparent reason for overwhelming infection after such a short labor. Both uterinotony and an amniotic fluid embolism would have been associated with excessive bleeding vaginally. Last question. A 20-year-old woman, gravida 1, para 0, who is at term, has been in labor for almost 8 hours. The membranes ruptured 2 hours prior to the commencement of the contractions. The fetal heart rate is regular at 144 per minute. The contractions are of good quality, occurring approximately every 2 to 3 minutes and lasting 45 seconds. The cervix has been fully dilated for 1 hour, and she has been pushing for most of this time. The vertex is judged to be in the occipito-anterior position and has descended from 0 station to a level 2 centimeters below the ischial spines in the last hour. Which one of the following best describes the situation at this point in time? A. Obstructed labor. B. Maternal distress. C. Delay in the second stage. D. Cephalopelvic disproportion. E. Normal progress. There is no evidence of obstructed labor or cephalopelvic disproportion, as progress has not ceased, and there has been no arrest of the labor. B. There is no evidence of maternal distress such as tachycardia or pyrexia. The pattern is that seen in normal labor. E is correct. Progress is still occurring as the head is descending in the pelvic cavity, the position is favorable, and the duration of the second stage is 1 hour so far, with this being only half the length allowed in a normal second stage in an oviparous individual. Thanks for watching, doctors. If you find these videos helpful, you may share it with your colleagues who are also taking the AMC exam. All the best.